It is looked down upon to struggle with substance abuse. It is seen as a legal issue, where if any discernible ingestible/sellable amount of drugs is found on a person, or they are suspected of participating in trafficking, they are prosecuted. They are fined, sentenced to probation, community service, or jail time with a misdemeanor or felony drug possession charge, depending upon the amount determined to be present. What about the drug addiction that man or woman is dealing with? That is a medical problem, not a legal one. Left bracket, right bracket. But oftentimes, men and women spend months or years in jail not focusing on the health care that they need for the mental, emotional, and physical changes that their body has undergone. During their time of drug use and imprisonment, they are not focusing on a proper drug rehab program for their own health and recovery, but the community and government could take that interest for them and for the interest of the community upon that prisoner's release. With an inpatient facility, you are also going to receive around-the-clock care. If you need a doctor or medical attention immediately, you will have this on site. Or if you simply need to talk to someone at any time of the day, you have it on site. With 24/7 care and with on-site staff at all times, you are never going to go without, and you will never be lacking in the support system you need when you do choose this inpatient facility option for the treatment you need to get clean. Because when it comes to local, state, and federal public health programs for drug abuse, there have been too many financial sacrifices made in this area. There have been cutbacks in the availability of these services because they cannot meet the intense demand of many communities, and the lack of assistance with safe medically assisted detox or effective therapeutic rehabilitation does nothing for the prevention of or management of substance abuse in at-risk communities where criminal activity and substance abuse are connected in many ways. It is time for nicotine drug rehab to become as mainstream as treatment centers for other addictions. Alcohol, prescription drugs, illicit drugs, gambling, sex addiction, food addiction, internet addiction, and nicotine addiction all have the same solution. The solution is found in the spiritual principles of the 12 steps: complete abstinence and a safe place to recover, discover, and transform. A drug treatment program addresses the physical and psychological issues of an addict. Several individuals are able to recover from substance abuse when they undergo drug rehab programs. Medical specialists and addiction treatment experts monitor and evaluate the condition of inpatients so that their needs may be addressed. Furthermore, social and behavioral symptoms are examined, and the ideal treatment option is recommended for the complete recovery of these patients. Since the mid-1970s, numerous scientific studies have presented that the success of any addiction treatment includes behavioral modification. By altering a drug addict's behavior towards these illegal substances, he or she can also avoid relapse. The National Institute on Drug Abuse NIDA stated that recovery from addiction to drugs is a long and tedious process. This also requires multiple sessions and episodes of treatment. After years of study and research, addiction treatment experts have determined the essential elements to recover from drug abuse. One of the most effective therapies of drug rehab programs is cognitive behavioral therapy, also called as CBT, a kind of one-on-one talk counseling that explores negative emotions inside drug addicts and how these emotions push detrimental behavior. To completely reap the key advantages of this proven effective treatment method, patients should be given a substantial amount of personal attention. Psychological assessment can be critical in the entire treatment procedure, spotlighting emotional health problems such as depressive disorders, stress, mood, or any dissociative disorders that have resulted from drug abuse and addiction. Drug tests will also be carried out to determine the ideal choice of treatment and drugs. In the course of long-term drug addictions, a lot of addicted people simply haven't acquired the basic life skills essential to thrive in the society. Most of the drug treatment centers provide life coaching, stress tolerance training courses, anger management strategies, personal time management training, as well as organizational guidance, so as to help place drug addicted people on the road to prosperous and healthy living. With a drug rehabilitation program, an individual can overcome several issues such as lack of self-esteem, violent behavior, and social concerns. Other patients may also be involved in minor or serious criminal activities, and these issues must be addressed as well. The goal of a drug rehab center is to remove the addict from a familiar environment so they may be prepared to function and thrive in a drug-free atmosphere that can ensure their total recovery. When the phases of withdrawal have passed, patients undergo a directed treatment program that targets their psychological dependency on the drug. They are also taught to strengthen their social and behavioral skills so they may be able to function well without the influence of the drug. This stage includes support group, family and individuals counseling. Trained professionals also provide the ideal behavioral or occupational therapy that can help rebuild the patient's social and life skills.